we are an organization. We're just going to start now, and I am amazed by the number of responses that we've got for this particular webinar. So I'll go in and dive in into the discussions of this webinar. So, Nexus of Discovery is an amalgamation of three entirely different concepts brought under one bracket by the healthcare system. So we have an amazing panel of speakers who are going to be talking about global networking. We're going to also be going to talk about research and translation medicine, the three main pillars that we believe at Academy of Clinical Translation Medicine. So, guys, stay tuned till the end of it, and we have an amazing, set of discussions that we're going to have throughout this webinar, and I really hope you have a very fruitful, conversation till the end of it. So, I'll start off with introducing our first speaker. Dr. Lamia Jouini is a clinical chief in psychiatry and psychotherapy with a MSc in global mental health from King's College London and London School of Hygiene and Tropical Disease, working at the Department of Psychiatry and Psychotherapy, Valles Hospital, Switzerland. She also works as a part-time consultant at the Brain Health Unit at the Department of Mental Health and Substance Use in Geneva. Her main areas of interest being stigma, perinatal mental health, medical education, and cognitive behavior therapy. She is the organizer of the WPA quiz sessions at the World Congress of Psychiatry. So I welcome you, ma'am, and we can start off with your presentation.
Thank you very much, Ashvas, for this presentation. Hi, everyone. Thanks for ACTM for inviting me to this webinar. I was asked to provide you with my personal experience, my journey through medicine, as an example of the importance of global networking and collaboration to success. So although I personally find it stimulating to listen to other people's professional journey, I hope that I won't bother you with my personal one. So before starting, there are three things that are important to know. The first one is that this is not a success story. This is just one professional journey among others. And I believe each one of you will also or are also having their proper journey filled with success and with failures. The second thing is that there is this presentation, but actually it is just few slides with some references about the things that I will tell you about. So you can maybe Google them if you are later interested to know more. And the last thing is that if you at some point hear some giggling and crying next to me, this is my 2 months baby that is sleeping and that might wake up at any moment. So first, I would like to say that as medical students, and after that as a doctor, we have this noble duty of saving the lives and relieving the pains of our patients. And this is, of course, not an easy task. It is a big responsibility, and we aim to do our best to fulfill that duty. So now, as a single individual, it is hard to know everything and do everything unless we are in a hypomanic phase, which is finally not a good thing and which might be tiring. Therefore, we need each other and we rely on each other in our practice. From that, collaboration is a very important aspect in our daily practice. We collaborate each day with patients in order to implement a therapeutic relationship and increase the chances of a good response. We collaborate with the patient's family to get the maximum of information about the medical history and circumstances of the disease. We collaborate with the nurses in order to provide a holistic care for our patients. And we also collaborate with colleagues in order to ensure a multidisciplinary care. And we finally collaborate with the stakeholders, the government, the ministries of health, in order to advocate for a universal and global care. It's important to understand that our approach needs to be a centered-based, focused approach. So collaboration is something that does not start from scratch. It's a spirit at the end. And now with collaboration, we usually increase our networking skills. We meet new people, we learn how to work together, and we give ourselves the best chances of guaranteeing success. So my name is Lamia Jouini. Thank you, Dr. Ashvath, again for the introduction. I'm really happy to meet all of you and to let you know a little bit about myself. I was born in Tunis, the capital of Tunisia. It is a really beautiful country, and I hope you all get the chance to visit Tunisia at some point. It is a country in North Africa, as you can see. And I studied medicine in the Faculty of Medicine of Tunis. And I am now working as a clinical chief in psychiatry in Switzerland and as a WHO consultant at the Brain Health Unit in Geneva. So let me tell you about my journey and how collaboration and networking made my career path until now. So as I said before, nothing comes from scratch. Since I was young, I was avid of meeting new people and having different experiences. When I was a medical student, I decided to candidate to be part of Associamed, which is the Tunisian Medical Students Association, in which I was the national officer of medical education. And I believe this is in India, it's called the National Association of India, or something like that, which is all part of IFMSA. And I encourage you to learn more about it if you are not already a member. So I had the chance to attend international meeting and to learn about projects running in other countries. And one of those projects was called Dying a Human Thing. It was actually a Polish project, and it consisted of increasing medical students' skills of breaking bad news to patients and their families. I thought by that time that this was something pertinent to our context, because in Tunisia, actually, we learn theoretically about terminally ill diseases, and then we go to the training, and then we meet with patients and families, but we never learn how to talk to them. So I decided to bring that project to Tunisia. And since then, a new collaboration started between Tunisian and Poland, and the project became a transnational one. And it gained national impact, actually, and several workshops happened in both countries with further collaborations with the national associations of cancerology, the Faculty of Medicine of both countries, the ministries of health. It became a huge project. This is a simple example of a collaboration between two persons working in two different committees at the medical studies level. But imagine all the other collaborations that are happening in the world and are still happening thanks to all the meetings organized every year by such international associations. Also, thanks to those meetings, I met more and more people and my network got larger and wider. So imagine gaining around 100 new friends after every meeting. So I can tell you that I have now on my Facebook around 3,000 friends. And someone asked me the other day if I knew all of them, and I said yes. I might not have shared moment with all of them, but I know who they are and where they are in this moment and when I met them. So from the national level, and because I became kind of known with the federation, I had later the opportunity to be elected as the liaison officer to UNESCO, which is basically which means that I became the I represented IFMSA at the UNESCO level and vice versa. So this position gave me the opportunity to attend the UNESCO 7th Youth Forum and the UNESCO 36th General Assembly. And from a medical-focused network, I got to know people from so many different backgrounds: young activists, law students, political students, folks, artists, etc. My network got even bigger and wider. And from medicine, I got insights about activities, discussion in UN agencies. And thanks to this, I could secure funds also for my organizations through the UNESCO participation program for two IFMSA projects running in low and middle income countries. One was about reproductive health and the other one was about human rights. A first-time new 3-year collaboration started between IFMSA and UNESCO across the world. How exciting and beautiful at that time. So that year was my last term in IFMSA, and I decided then to stop any activities to focus on my residency exam. I locked myself away and became a hermit, which, thinking about it now, was not the right thing to do, as I failed that year. So just saying that, again, this story is not a 100% filled of success stories, and that I failed as many times as I accomplished feats. So hopefully I sit for the exam again and succeeded, and I chose to become a psychiatrist. After that, I got involved right away with the Tunisian Association of Psychiatrists and Young Psychiatrists called JENPSY, of which I became the president in 2018. JENPSY organizes each year a congress, and that year we privileged to hold a common congress with the EMECAPAP, which is the East Mediterranean Association of Child and Adolescent Psychiatry and Allied Professionals. This collaboration with another international association could but only lead to path to further collaborations and common projects to advance the field. So as I was interested in stigma of mental health, I also invited Professor Sir Graham Thorncroft. Some of you that are maybe interested in mental health have heard about him. He's a worldwide known psychiatrist that is working in the UK, and he has even been knighthooded by the Queen of England for his great work in that area. So having Professor Thornycroft was a blessing, and thanks to that meeting, I had the chance to ask him about the opportunities in mental health field and the master degree in global mental health that I was longing to do since the start of my residency. And Professor Thornycroft liaised me with former students, and from one talk to another, I found myself applying for the Chevening Scholarship. And again, I guess many of you have heard about this scholarship because, you know, masters in the UK are really expensive, and people from low and middle income country like me and you can't afford to pay for the fees. So I applied for the Chevening, and I was lucky to be selected among the candidates. So I think for this presentation, it might also be important for you to learn about this scholarship, which is a very competitive one, and a very few percentage of applicants get accepted, usually after a 1-year selection process. And one of the 4 essays that you must write is about your networking skills. So the applicants should mention his networking and personal relations at the national and international level, and talk about how he deals with people in a variety of professions, including governments, public authorities, academia. So you know how important it is to have a solid long-term network. So since I already knew Professor Thornycroft, as I told you before, he was appointed as my mentor. And during my studies at King's College London, I could regularly benefit from his advice and experience. And again, that year in the UK was an amazing experience because not only the master allowed me to get to know people from so many backgrounds, but also I was living in an international student's house. And in this house, we had students in law, in music, in literature, engineering, human rights, etc. So again, my network was bigger and got wider. So after that year in the UK, I went to Switzerland, where I wanted to have a different experience in a high-income country, and I started again the psychiatry specialty there. A different environment, a different challenge, a new network of professionals. However, I always wanted also to do some public health work, and for instance, work with a UN agency in the mental health field, mainly with the World Health Organization. So what happened is that thanks to my network, my dream came true. Actually, the network was a big asset because when the Brain Health Unit team from WHO needed a consultant to help with some urgent job, they asked Professor Thornycroft, and he recommended me as a future leader in global mental health. And since then, I work with WHO. I can only witness cross-continental collaboration, and my network is again growing bigger. So for example, right now we are working with my WHO team on perinatal mental health. And what we are doing is that we are helping in-country teams. We are collaborating with them in order to implement maternal mental health services in, mental health services in maternal and child health services. And this is another level of a global collaboration. So going from collaborating between student organizations to collaboration between students in master degrees to collaboration at the international level. There are so many other examples of collaboration in global health, actually. For example, in mental health, my field, there is the Indigo project, which is an international collaboration of research experts committed to the promotion of mental health by reducing stigma and discrimination related to mental illness, We also have the Intrepid research program, which is studying the epidemiology, the phenomenology, and the etiology and outcome of psychotic disorders in diverse settings, and so on. So, and this is where I am now on my journey, working as a clinical psychiatrist in Switzerland and as a part-time consultant for WHO. It has not always been a successful path filled of questioning and challenges, but I can say that I can only remember the nice sharing I had with the people I met along the way. In our field specifically and in general in medicine, networking is an essential asset for achieving our goals, and collaborations are the essence of our work with patients and in research as well. So I hope this autobiography was not less than an example of the role of collaboration and networking in someone's journey as a medical student or as a doctor. And I will finish this very quick presentation by wishing all of you the best for your future and for your career. Thank you very much.
Thank you so much, ma'am. That was an amazing session. A quick one. We had to have a quick one, but an amazing session. You touched on to the key points of how global networking can reshape your entire career, and how can it, from a person starting from a scratch, how can it change the way the person ends up? So networking is a key that is something we can derive from this, and a global collaboration can change your entire perspective of the healthcare that you look at. So another, and I'll be reiterating this throughout the webinar, but global networking and connections and collaborations is something that ACTM focuses at, and we cannot stress enough how important this is for the healthcare system. So we do hope to, see this in action. We want to see how global networking can be used by all the medical students of the next generation and put it for their own personal use and, change the way the future of medicine works. So thank you so much, ma'am, for such a wonderful session, and hope that everyone has, a good amount of idea about global networking. If anyone has any doubts, you can go ahead and put it in the chat box or unmute yourself and ask the question right away. Ma'am is there to help you guys out. Anyone can feel free to unmute yourself and go ahead.
Well, she's here.
Okay, you can drop it in the chat box too if you guys have any doubts, or in the WhatsApp group. We'll get back to you on that soon. Okay, so we have a question. How and where to find networking and networking opportunities during college? So, ma'am.
I would try to answer the question, but actually I think maybe Ashvath and Rohit would be better than me answering this question in your specific context in India. But as I said before, I think the most important thing is to be open to new connections, and maybe to start with is the local organization, medical students organization of your country. You can start with this, or some club that you have, or even any other kind of organization that are around. And from one connection to another, you usually always find new opportunities that you can grasp. And it also depends of what you want really, what is your ambitions. So if I have an advice to give, maybe is that first to understand what you want, to decide like what are my main goals, and then according to that, where can I find them? Which organizations, which persons, which association, which activity? And maybe I will let Ashvath and Rohit complete if they have any other things to add regarding the Indian context.
So I guess the best platform to start off with would be ACTM. So that is the entire motto of having ACTM as an organization. So we want to foster a global network. We want to have connections across the globe between students from different countries, from different states in India itself. So answering your question, ACTM would be a best place to start off with. Dr. Rotsa, would you like to take up a point for that?
Yes. So this the whole idea of ACTM is to foster collaborations, but then through the network which are already present in all over the world, like how Dr. Lamia also rightly said, depending on your field of interest, depending on the way which professional you are going to be. Maybe you are going to be a child and adolescent specialty, geriatric or adult. In adult, you are going to be a medical person, a nephrologist, a surgeon, or not. There are particular organizations which will be putting the interest of putting the interest of students first. For example, a very good alternative, a very good, one of the advances which is made by the Royal College of Psychiatry is that they have something called as nurturing psychiatry, as in for people who are, as a psychiatrist I'll speak of psychiatry more so, but what I mean to say is that different this is just one of the organizations which is fostering the collaborations for people who are psychiatrists already, or rather who are medical students who are willing to take up psychiatry as a specialty. They can join the Royal College of Psychiatry free of cost and see what are the activities and what are the ways to take up psychiatry, or what are the reasons why you should choose psychiatry or why you should not choose psychiatry, so as to guide you further. Now I have attended a multiple amount of conferences who are having, and I have close to around 20 or 30 affiliations with respect to partner organizations, and a lot of organizations which are pioneers in their own field. So, what I want to tell you at the outset is there are special discounts and special perks which are available to students who are interested to join the field. Maybe I'm talking about World Federation of Neurology, for example. It has definite, perks of joining as a student. Now, International Parkinson's and Movement Disorder Society, they also have particular perks for Indian students also, perks for Indian pre-professionals or para-professionals also. So there are a lot of ways to increase your collaborations in such a way that it propels you to a better career when in your student life itself. So definitely, we would be happy to guide you ahead and further in your journey to become a great professional in the future. Looking forward to see you all as a part of ACDM in for a long time to go. Ashad, you can take over.
Thank you so much, sir. Yes, sir.
So
Thank you so much. So, yes, sir.
sorry, just
Yes, ma'am.
to finish by ending that, I will write my email, my professional email on the chat. And if there are any other question regarding any aspect of the ones that are presented, please feel free to email me.
We will put it on the WhatsApp group too, so that if anyone has any doubts or they want to try to contact you, they can go ahead and do it. Perfect. Then. So, without further ado,
I would also want to take this moment to thank Dr. Lamia, who on such a short notice presented such a stellar, virtual journey of what her actual professional journey has been, and it was so nice to have you, Dr. Lamia, here. Thank you.
Thank you, everyone. And I will have to leave at this moment. So I hope to see you around in the future. Bye.
sure. Bye-bye. Thank you so much. So, yes, so without further ado, let's go on to the next speaker. Dr. Pracheth is an associate professor in the Department of Epidemiology in Enhance. He has conducted copious volumes of research across diverse fields. He has over 40 publications in peer-reviewed journals. He has also authored a chapter in the IAPSM journal, textbook of community medicine. As a principal investigator, he has received research grants from organizations like ICMR, the Union, and the National TB Elimination Program State Task Force. He has guided many students for ICMR STS program too. He has received the Best Paper Award in conference on 9 occasions and has delivered more than 100 talks as a resource person. We are more than happy to have you for our first webinar, sir. The stage is all yours.
Thank you so much for that introduction. I hope I'm audible. So at the
Yes,
outset,
you are.
I'd like to thank you all for inviting me here. And it was indeed wonderful to listen to the first speaker, Dr. Lamia. So just give me a moment. I will share. So is it possible to read everything about research in 20 minutes? So the answer is no, but I try to give you an overview of the same. So what is research? Research is said to be what I'm doing when I don't know what I'm doing. So we do research in our daily life as well. We look at various online shopping websites. We do a lot of browsing on web. Even that may be considered as research. Well, I want to check out my friend's social media profile. I go to Facebook or Instagram and type his or her name, and that pops up. So all those are various forms of crude research. But here we are here to learn about medical research, the various steps and why is research important, and what does one do after research? How does one disseminate the findings of research? This would be the outline of my presentation. So what is research? So is it so that when the first time we are searching for something, is that called research? No. Research is knowledge acquisition that is gained either through reasoning, through intuition, and by use of appropriate scientific methods. So we have that misinformation that research always needs to be new, right? It is good if it is new, but at times research need not be. So the purpose here is to discover answers to questions by applying scientific procedures and to find out the hidden truth. So every research has its own purpose, whether it is small or big. So every research has its own aim as well as specific objectives. So why is it that one must do research as medicos? So 60 of you have logged in here to understand why one must do research. So many of them do it for the sake of doing it, for their degree, for their career, for their academic requirement. Many of the undergraduate students, before I was teaching in a private medical college, and many of our students would come to us and say, okay, I want to give USMLE or PLAB, and therefore it's a requirement for me to carry out a research project during my internship or during my MBBS. So that is just for the sake of doing it. So we should think beyond that. So research needs to give us joy, some passion. We need to be passionate about research. So we need to get that joy from solving unsolved problems. We need to do some service to the society by carrying out research. Plus, if we are good at research, if we carry out meaningful research, there's a certain amount of respect that we gain. Okay, and research is now a part of the undergraduate medical curriculum. So research needs to be planned well. Otherwise, it could be very stressful. Trust me, I've gone through this stress many a times in my career. So we need to know what the basic steps of medical research are. Number one, we need to identify our topic or the problem. So analyze why we want to do the research, analyze the needs, do a review of literature, review what work has been done on that particular area, determine the significance of the problem, and then take it from there and formulate the research hypothesis. So the first basic step is to identify the problem area or the topic and then carry out a literature search wherein we try to identify the existing research and information about our chosen topic. So what is the current state of knowledge? What has been published? What are the drawbacks or gaps in the existing literature? The answer to that is through a literature search. So once we do a literature search, we need to write something called literature review. Literature review is different. Literature review is nothing, it's an output of the literature search. So in literature review, we analyze and sort of evaluate and synthesize the evidence from various studies through the search process. And then we draft a document. So that is a literature review. So where do we look for literature? So we have various databases like Medline, PubMed, Scopus, Embase, Cochrane Library, and of course, search engines like Google Scholar. So many a times we might also want to manually search the various online journals or manually search references of key articles. So always ask your faculty guide or expert for the studies on that particular topic and forthcoming research as well, because they are the ones who would be well aware of what research has been carried out in that particular field. So we have now searched for literature, we have collected some article or evidence or literature that is already available on that particular topic. What next? Next is to formulate the objectives and take it forward, plan the research. So what is the single most important aspect of a research study? So it is not carrying out a research, it is the research question. So research question is like a foundation. So a question that is well asked is a question that is half answered. So research question is a question that the research intends to answer, which needs to be inquisitive in nature. So will an intervention be effective when compared to the usual practice in reducing or usual care in reducing depression among pregnant women? That's a question. right, which we seek to answer by carrying out a research. So what is a hypothesis? Hypothesis is like a supposition or a statement or a proposed explanation on the basis of the limited evidence that we have. So it is like a starting point for further investigation. So through our research, we can either prove or disprove the hypothesis. So in the previous slide, I told you about a research question. If the same question is in the form of a statement, for example, an intervention will be 10% more effective in reducing depression among pregnant women when compared to the usual care or standard of care. So that's a hypothesis which we can either prove or disprove through research. So please understand the difference between a research question and a hypothesis. Research question is a question that we seek to answer by carrying out a research study. Hypothesis is a supposition that we arrive at on the basis of limited evidence, which we can either prove or disprove by carrying out research. So there are certain criteria that a research question needs to follow. We call it as FINER. F stands for feasible, I for interesting, N for novel, E for ethical, R for relevant. What is feasible? Is it feasible? Will we get adequate number of study participants? Do we have the adequate amount of experience or expertise to carry out this particular study? Is it affordable in terms of time, manpower, and cost? So that is feasibility. Then comes interesting. So the research question should interest me as an investigator. It should be interesting to my peers or researchers. It's impossible to seek validation from everybody, but at least some of them. It should interest us at the end of the day. So that is interesting. Then comes novel. What does new mean? So either it could be the first ever study on that particular issue, or it could be a first ever study in my setting. For example, I'm in Bangalore city of India. So this could be the first ever study in my setting. Or it could improve upon the methodology of the previous studies to address the limitations or gaps in that study to obtain better valid findings. So there could have been a study on that particular topic in Bengaluru in the past, but my aim of this research is to improvise on that and to address the gaps of that study. So that is novelty, which is absolutely imperative. Then comes ethical. A good research question must always be ethical. So the research needs to be approved by our institutional review board or ethics committee, IEC, Institutional Ethics Committee. So that is ethical. Then comes relevant. How will the findings of the study influence the practice guidelines? How is it going to add to the body of knowledge? How is it going to guide future research? So that is relevant. So please remember this FINER criteria. When you draft a research question, always ask yourself whether it fulfills the FINER criteria of research question. So you can see the difference between these two questions here. The question number 1 says, does watching TV cause obesity? And question number 2, which is an improvised version of the research question that follows the FINER criteria. In school children, is increased TV viewing for more than 4 hours a day associated with an increased incidence of obesity as measured by using BMI compared to moderate TV viewing, that is less than 1 hour per day. So this is much better and it fulfills the FINER criteria. So it's an art to learn how to draft a good research question. Then comes research objectives. We need to formulate our objectives. So objectives are nothing but planned endpoint of all activities. So and these objectives need to be SMART. What does SMART stand for? Specific, measurable, achievable, relevant, and time tested. And we need to use certain action verbs in the objective, like to determine, to assess, to evaluate. These are some examples. To quantify, to study, okay, to verify, to investigate. These are some action verbs that need to be used in the research objectives. Many of them use some loose terms like to know, to find out. Never do that. So please use appropriate action verbs in the research objectives. So these are some examples of research objectives. So let's have a look at this. To determine the prevalence of hypophosphatemia in critically ill children. To evaluate the use of blood and blood components issued from the blood bank of a tertiary care center. So please make sure that you use the appropriate action verbs. So there is a difference between aim and objectives. Aim is the broad purpose of the study. For example, to determine the prevalence of hypertension among adult population in a rural community. That is the aim. So the aim that is broken up into parts. How would I achieve the aim of the study? That is nothing but objectives. So the objectives in this context are to determine the prevalence of hypertension among the adult population and to assess the factors associated with hypertension among the adult population. So the objectives are nothing but aim of the study broken into parts. Objectives could always be multiple. Objectives are more specific, whereas aim is more broad and generic. So please understand the difference. So we have formulated the objectives now. So objectives need to be specific. We need to be able to measure it, measurable, achievable, relevant, time tested. Okay. Next, what next? Next is to learn about what types of research are there. So broadly, we have quantitative and qualitative. Quantitative is something that we can measure. For example, prevalence of diabetes in the community or proportion of patients seeking healthcare in a hospital who screen positive for depression. So that is quantitative. Quantitative is when we are measuring. Qualitative is when we are asking certain questions like who, what, how, when, why. So we are trying to understand the nature or quality of a phenomenon. So if I'm trying to understand why there are barriers for people to seek healthcare in the context of psychiatric illnesses or mental health problems. So the best way to do that, to answer that question, or what barriers are present, and why is it that people are unable to seek healthcare for certain conditions. So the best way to answer that question would be to carry out a qualitative research, wherein we can either carry out key informant interviews or in-depth interviews, one-on-one interviews using an interview guide, an in-depth interview guide. Or if the topic is not that sensitive, we can also carry out a focused group discussion, a discussion in a group of 6 to 8 individuals, which is moderated by the researcher. Of course, we need to be explicit. We need to have a guide here as well. We need to record the proceedings, take consent for that, and then transcribe it. So qualitative research is when we seek answers to understand the nature or quality of a phenomenon. If we are trying to understand the magnitude of an occurrence or an association, or we are trying to measure something, then the way to go is quantitative. So when we build a house, we need something. We need a land or a plot first, and then we need to have a design as to how many rooms are present, where is the kitchen going to be, where is the drawing room going to be. So here, when we are carrying out a research, we need a design here as well. We need study designs. So we need to choose an appropriate study design. And these study designs are broadly divided into observational and experimental. The observational studies are, refers to studies when the investigator does not intervene, just observes. Okay, so we have different types here. We have descriptive and analytical, which could be further subdivided into cross-sectional, case control, and cohort. So if we are carrying out an experiment, or we are trying to find out the effectiveness of a therapy or a procedure or a drug, the way to go is to carry out an experimental study. So that could be further divided into randomized control trial or non-randomized trial. Okay, so we need to choose an appropriate study design and look at the strength of evidence. So this is just to give you an idea. So every study has its own advantage and disadvantage. So you can see that case series and case reports, they are somewhere at the lowest point of the pyramid. Above that, we have cross-sectional studies, case control, cohort studies, randomized control trial, systematic reviews, and meta-analysis is the strongest form of evidence. But you need to be comfortable. You need to, as Dr. Lamia said, we need to collaborate here as well. You may need to collaborate with your guide, who could be a faculty member or a senior, or even your peers, and then decide what study design suits to answer your research question. Okay, so now we have identified our study design or research design. What next? Next is to prepare a research protocol. This is a document that describes why we need to carry out the research, the background, the rationale, the objectives, and how we are going to carry out the study, the design, the methodology, the various statistical considerations, and the entire organization of a research study. So there are different parts of a research protocol, starting from introduction, review of literature, objectives, materials and methods, and references. So first comes the introduction. So here we set the scene. So we give certain definitions. We try to define the problem. We then come to the specific question that we intend to address by carrying out the research. What has been done before? What were the problems with the previous research carried out on that particular topic? What is still unknown? What are the gaps? And what exactly is new with my study? We always conclude the introduction with the broad aim of the study. Then comes review of literature, which I have already explained to you. After that, we have materials and methods, wherein we describe the study design, the study setting or the area where we are carrying out the study population, whom we are going to include, whom we are going to exclude, the sample size, the study period, the variables in the study, the data sources, the data collection procedure, data analytical techniques, as well as ethical considerations. So every research needs to have variables. We have dependent variables or outcome variables and predictor or independent variables. Dependent variable or outcome variable is the main outcome that we are looking at. If you look at this example here, a study of optic nerve damage among patients visiting a tertiary care hospital. The outcome variable here is optic nerve damage. And then there are predictor variables or independent variables, which could be age, gender, presence of comorbid conditions. What are the variables that would likely to influence, or what are the factors that are likely to be associated with the outcome variable? If you look at this example here, profile of patient with acute febrile illness admitted in a hospital. Acute febrile illness is the outcome variable over here. So many a times we also have to draw a Gantt chart or a study timeline. So what are the various activities in the project and what is the time required for each of the activities? That needs to be clearly, explicitly mentioned in the form of a Gantt chart or a study timeline. So this is nothing but a visual display of the various activities in a research project. Then comes the ethics section. So we always have to take clearance from the institutional ethics committee. We need to take permission from the authorities before carrying out the study. We also need to have a participant information sheet wherein we try to explain the procedures involved in the study in the patient's own language. And then we seek written informed consent of the participants. And every participant or every individual has the right to accept or reject or to deny participation in the research without affecting their healthcare in the hospital or healthcare settings. Then comes the reference section. So whatever literature we have referred before, during and after the study, we need to cite them. These could be books, journals, documents, etc. So there are different reference styles. The one that is commonly used is Vancouver style. After this would be the implementation stage, wherein we go and collect the data. So before we collect the data, we need to have a questionnaire or a pro forma. Okay, so we have different types of questions, open-ended or close-ended. Open-ended is mainly in qualitative, and then we have close-ended. Close-ended questions could be either dichotomous question, yes, no variables, or it could be multiple choice questions or rank order questions, wherein we rank a particular variable. So after that, we design the questionnaire, and then we always have to pilot test it on a sub-sample. Suppose my sample size is 500. I need to pilot test my questionnaire or pro forma on maybe 10% of the sample size. And then I make necessary modifications. And finally, I finalize or revise the questionnaire and then print it, go ahead for data collection. So we always have to avoid technical terms while drafting a questionnaire, avoid jargon, use very simple language, avoid ambiguities. Okay, so the questionnaire or the study instrument should be reliable and valid. Reliability means consistency. Is it reproducible in other settings? Validity means, is it measuring what it is supposed to measure? So these two have to be satisfied by a study tool or a questionnaire. So you can look at this example here. This is the example of a reliable and a valid tool. So reliable, we are getting consistent results over a period of time. Okay, and valid as well, because it is measuring what it is supposed to measure. So once we do that, once we collect the data, we need to actually store our proformas. We need to make sure that they are safe, and only the researchers need to have access to it. It's a good practice to do data entry immediately after data collection. We need to have a backup as well in case we lose our data. So we need to store our data collection forms or proformas for at least 5 years after the completion of the study. After that, we can discard it. So only collect the data that you're going to use, be systematic and backup. After that, we go ahead and do data entry. So nowadays we have a lot of softwares that can be used wherein we can enter the data directly on the smartphone. And of course, we have a lot of other data entry softwares like Excel that can be used. And then go ahead, once you clean the data, go ahead and analyze the data using an appropriate software. Here, it is important to always consult a statistician. So now we have done our research. Next step is to disseminate the findings. So either go to a conference, there are conferences of various associations, or go and present your findings and disseminate it to the scientific community, or publish your findings in peer-reviewed journals. Always look at the indexing, should either be on PubMed or Scopus or Web of Science. Go and publish it in a good peer-reviewed journal. So it's very important that we communicate our results properly. Our results should always be relevant to the objectives. Okay, we should only state the facts, nothing else. We need to have tables and figures, and these tables and figures have to be standalone. So we only need to report those outcomes that were a part of our objectives. Then comes the discussion section. So discussion is when we summarize the main findings of our study. And we tell the reader what is new, why is this study important, what are the strengths and limitations of the study. Here we may have to speculate, we have to compare with the other studies that have been carried out on this particular topic. We may have to speculate wherever needed, and we also need to give recommendations. So then comes the conclusion sections, which is based on the study findings. So what is the main takeaway from this particular research? That is conclusion. Okay, so now we have drafted the entire paper. Then we need to sit and decide our title. So title is the first chance to catch the reader's interest. But having said that, it needs to give some specific information. There are certain guidelines that we need to follow while drafting the title. So go and select a title that is unique. At the same time, the title needs to convey the information or the main aim of that particular study. So these are different examples of title. So when we submit an article to a journal, the journal always asks for a title page. So we need to state the title there, the authors, the various authors, their email address, their institutional affiliations. We need to decide who is the corresponding author. Corresponding author is the one who corresponds with the editor of the journal. So all those things have to be mentioned in the title page. Then we prepare the abstract. Abstract is written after the paper is completed. And it's nothing but a short summary of 250 or 300 words, when we reflect the study findings and we summarize what has been carried out in the research. So that is abstract. Then comes the various other sections like acknowledgement. We need to acknowledge everybody who have helped us. Those who cannot be listed as an author, we need to acknowledge them. If we have received funding, we need to state the source of funding. Conflict of interest, if any, has to be stated. Author contributions, who has done what, that has to be stated. And then comes the references. So this is an example for author contributions. So only people who have been involved in the research, who have either conceived or designed the experiment, or who have performed the data collection or analyzed the data or written the paper or edited the paper or provided their inputs to revise the manuscript, only those people can be given authorship. It's unethical to give authors to others, like we have something called gift authorship. So that's a practice that needs to be avoided. Then comes the references in a manuscript, in a publication. Always limit the references to the most recent ones. And every journal has its own style. Check the journal styles and keep a copy, download a copy of all the reference articles. We have various reporting guidelines that can be used. There's something called STROBE which we use for observational studies. Similarly, we have reporting guidelines for other types of studies also. So if you are a medical student, there are various research funding opportunities. In India, we have something called ICMR STS, which comes out once a year, Indian Council of Medical Research, short-term studentship. And of course, we have various other associations, subject associations, who may fund research for postgraduates. And for undergraduates, we have certain universities who give seed grants or intramural grants. So if you're lucky enough, you may get money to carry out your research. Even if you don't have funding, please don't worry. If you're motivated, if you get some passion out of it, go ahead, jump in and carry out research. So there are a few tips for research. Always collaborate. It's not one person's task. So whenever I'll narrate from my own personal experience, whenever I've ventured to do something alone, I have failed most of the time. So it's important to collaborate, take guidance, consult, plan properly, and then implement. Adhere to the timelines. Note down things in a piece of paper or a notepad. Adhere to the timelines, and then make sure you disseminate, publish the findings of the research. So this is the summary of the top. I have tried to tell you why exactly one must do research and the various aspects of a research protocol, starting from the research question, hypothesis, objectives of the research, introduction, methods, and then how does one carry out data collection, what are the aspects of a questionnaire, and how to manage the data, and how does one disseminate the findings of the research. So these are some of my references. So I'd be happy to take some questions now. I hope I didn't bore you guys. So let's have some. Hi.
Yes, sir. So if anyone has any questions, you can drop it down in the chat box or unmute yourself and go ahead. Before that, a wonderful session, sir. You have covered everything that a person needs to know about research right from the start to the end. So, what our professors have tried to teach us over the course of 3 months, you've done it in 30 minutes. A brilliant session, sir. And as you said, we have tried to link again collaborations and research. And, research is something that you need not be afraid about. Research is something that is not very a scary thing for a novice person who's going to start off with their first research project. It is something that you need to, be aware of. You need to do it not for the sake of your CV, not for the sake that you are going appearing for your, USMLEs or lab exams, but it needs to be done for bringing about a change in the healthcare system. So, helpful research is what is required by the next generation of doctors. So, brilliant session, sir. Thank you so much for the valuable insights. We can go ahead and we can take questions. If anyone has, you can go ahead and drop it down in the chat box. I had a couple of questions people had asked me. So
Sure.
for a person who's starting off with their first research, what would be the ideal type of research they should be starting off with?
Well, start off with something very simple. I would suggest go for a cross-sectional study. So
Right, sir.
the first step is to identify what excites you, what is that area that you would like to work on. We have so many subjects, right? Starting from the preclinical subjects to paraclinical, clinical. You need to identify where your heart lies. Once that is done, start off with something simple, okay, and do it sincerely, try to implement it, and then go ahead and publish the research. So unfortunately, most of the research that we do don't see the end of the day. The logical end is not completion of research, it is to publish it and disseminate the findings. So I would suggest go for something simple, cross-sectional study, and then later on, maybe once you gain some experience, you can of course go for case control or other approaches. So as undergraduates, you will not be allowed to do experimental study. So only unless somebody has a postgraduate degree, usually the ethics committees, institutional ethics committee may not approve it.
We also have a question that can we get this PPT for future references?
Yes, I'd be happy to share it. So
Sure,
I'll
sir.
share it.
Sure, sir. Sure, sir. Thank you so much. One more question is that what are the different research publication platforms? So I guess you covered in your session, but we have this question again.
So I'll just summarize that. Yeah, we have different journals, of course, and we have different indexing agencies like PubMed, Scopus, Embase. So these are all considered as quality journals. If it is peer reviewed, if it's either on PubMed or Scopus, then we can say that it's a good quality journal. So that's a measure of quality, basically.
How do we publish these journals in index references is another question that we have.
Okay. So, one must have that motivation, willingness to work on it. Collaboration is the key because it's not that one person will be able to do it. So you need to collaborate maybe with your peers, your seniors, take guidance from your faculty members, and then do it as a team. So if we work as a team, then you will be able to publish it. First and foremost, you need to get that first draft ready. Okay, once you get the first draft ready, go to your guide or your mentor, and the mentor will be able to give further inputs and revise or refine that particular draft. And then go ahead and send it for publication. So you will have to send it for publication. Most of these journals that I mentioned, which are on PubMed or Scopus, these have an online submission system. So you go online, there's a portal, you'll have to upload your documents, your blinded manuscript wherein you don't include any of your details. It should be anonymous. So that needs to be uploaded. And then there's a separate title page wherein the author details, the contributions, whatever I mentioned in my PowerPoint needs to be uh, uh, drafted and uploaded. So once we upload it, there is an editor for every journal or an academic editor who is assigned this particular manuscript. The academic editor can reject the manuscript at his stage itself, at the initial stage. So he quickly screens the manuscript. If he finds that it is not interesting, he can reject it. If not, if he finds that the manuscript is acceptable, the next step is he will send it across to reviewers. So it is sent to at least 2 or 3 reviewers. The reviewers take their own sweet time, review the entire manuscript. If they're happy, they accept it. If not, they get back or they send some queries or comments. And these comments need to be addressed by the authors, and we need to upload a revised manuscript. So it keeps going back and forth. It's not that easy. It may take months. Many a times it takes 1 or 2 years for a manuscript or an article to be published in a good quality journal. So it's a process. I would say it needs a lot of motivation, it needs patience and hard work, most importantly, collaborative work. I hope I have answered that question. So as a medical graduate, how do we grab the chance of research? Well, now with the latest CBME curriculum in India, we have the competency-based medical education. Research has now become an integral part of your MBBS course. So a lot of the colleges have now started integrated research into their curriculum. So they have student research projects, a posting in the community medicine department, usually in the second year, wherein 1 month they are made to do research under the guidance of a faculty. So that is there. If that is not there in your college, do not worry. There would be some faculty members who would be very proficient in research. Approach them, identify what excites you first, and then approach the right expert, and then you can carry out research under their guidance.
I guess that's all the questions we have. So if anyone has any doubts, you can put it in the chat box or unmute yourself and ask. Perfect. Or you can put it in the WhatsApp group also. We can connect with Dr. Pracheth later and answer this question. So a wonderful session, sir. Thank you so much again
Thank you for inviting me.
Thank you
Thanks to
so
all
much,
of
sir.
you, to Kadir, to you, and to your entire organization. I wish you all the very best. It's nice to see that so many of you are enthusiastic and attending this session. Thank you.
Thank you so much, sir. So, moving on to the next speaker, our very own Dr. Rohit sir. He is the founder of ACTM, and Dr. Rohit sir has completed his master's in psychiatry in 2021 from Goa University, India, and is an early career psychiatrist. He's a member of World Psychiatry Association's Earlier Career Psychiatrist section. He's also a member of the World Health Organization's Good Clinical Practice Network and International Master Society for Perinatal Mental Health. He has experience as a tutor cum mentor for students from MBBS, MD, MPhil, psychiatry, social work, and post basic diploma psychiatry nursing. So, welcome, sir, and we would be more than happy to hear your insights about the same. So we'll be talking about translation medicine. Translation medicine is the third most important pillar of ACTM, as the name itself suggests, Academy of Clinical Translation Medicine. We want to focus upon translation medicine. So, sir is here, and the stage is all yours.
Thank you, Ashwath, for the introduction. Let me take it from here. So, I'm Dr. Rohit. I'm an assistant professor of psychiatry. I'm a member of WHO Good Clinical Practice Network and a member of World Psychiatric Association's Early Career Psychiatry section. I'm one of the top 20 Indians to be selected into the WPA-ECP section. And together with my professional connections from United Kingdom, Iran, Montenegro, and Nigeria, and some countries in Europe, I have co-founded an organization called as a Global Psychiatric Association, and that is a very non-bureaucratic organization. And today we are at the inaugural webinar of Academy of Clinical Translational Medicine. So this is something which is a frank endeavor to promote training needs of medical students and a lot of other paraprofessionals also. So as to directly go ahead and tackle the main thing, what makes us doctors, right? That is about training needs. Now, to delve further into just not medicine, we are talking here about translational medicine, which is a step further. So what essentially is translational medicine is something that I'll be talking to you all in this webinar. And we will be talking about the epistemology and the future directions in this webinar about translational medicine in this session. So first and foremost, what is translational medicine? It's basically imagine you are in University of Oxford and you are in a genetics lab and you are talking about RT-PCR and gene sequencing and exome and intron splicing and sequencing and then creating a new genetic material out of it. So why would you be doing that? You would be doing that possibly hypothetically if we were to take a case of cystic fibrosis. You would be wanting to knock out the gene of cystic fibrosis or make it less harmful or make it something which is going to be more beneficial for the patient. That would be your main motto, right? So in this case, what translational medicine means is that you are making something in your lab so as to translate to a better clinical practice and better outcomes for the patients. Now, when I'm talking about translational medicine, what is translational medicine and what, apart from all the things that the previous speakers have talked about in their respective talks, is that we were talking about research, right? So we do a lot of research. We do a lot of studies, case control studies, anything, clinical reports also for that matter. But what is important is that how much of it is actually having a translational value. As in, when we are doing something, we should be always considering what it would be and how much it would be beneficial for the masses. So that is where the translational value comes, the translational medicine comes, in which you think about what is the applied aspect of this particular research that I'm doing right now, and how it would translate to general clinical practice, and how it would be making the lives of patients that I'm treating in my bedside better. So, what is translation? It is about an approach which is very pertinent in today's world, so as to address the complex global challenges of finding solutions to human diseases. What it means is, basically, if a person is having a particular kind of, consider for example, COVID-19 pandemic. Now, COVID-19 pandemic is something which is which took up most of the time, especially if you are in a postgraduate curriculum, it took almost like 2.5 years, which is almost all of your PG program. it took up quite a lot of time. So, what is translational medicine and how it would have addressed the complex global challenges is that it is a viral disease, right? So, it will have a lot of gene sequencing involved, it will be having a lot of respiratory medicine specialists, and together, if there was an orchestrated effort with respect to finding better solutions to COVID-19 pandemic, it would have been cutting down the whole of the period of around 2.5 years to just about 1 year maximum. Suppose the variants could be more predicted, and we could tackle the situation better. So what it means is that it encompasses a multitude of disciplines using cutting edge technologies and facilities. As I was saying, it will include geneticists, it will include respiratory medicine physicists, it will include multiple number of people so as to have a better solution to a complex global pandemic. And of course, definitely, it would require to very closely to address unmet medical needs. Industry can mean any industry. Rather, it would be meaning a vaccine industry, it would be meaning medical industry, it would be meaning microbiological devices industry, anything and everything. So, how do you address the unmet medical needs? Is by looking at what are the needs. For that matter, we'll go more in detail of this definition and how we can provide such a platform to ACTM is something I'm going to call for, something that I'm going to talk about. So we're talking about what does it all encompass? Is that this is something that I found a very nice infographic online. First of all, you should be knowing what human disease you are, right? So if from a human disease you have a particular research question which we're looking at. Now, previous speakers had talked about the different types of research and what we can do and how to assess and how to start the research project and how to start, right? So we are talking about human disease. We are talking about a particular case of maybe COVID-19 pandemic. What is the idea or hypothesis that you want to tackle within the COVID-19 disease? In that case, what you would look out for is what are the basic research findings which are already present in the particular person, in the particular disease. In that particular thing, what are the basic hypotheses that you have, and what are the research findings which are in the favor of hypothesis or against the favor of the hypothesis. About what is exactly the translational medicine and how do we go ahead in this particular field. So first we look at the human disease which is under question, and then you find a particular idea or a hypothesis which you have a particular hypothesis which is to be researched, and then you go ahead finding the basic research findings which are there in the favor of your hypothesis or against the favor of your hypothesis. In that, you have a basic literature review first, and you see as to what are the different innovations and discoveries which are taking place in that particular field of question, your research question. Next is identifying that it is your intellectual property, whatever that you're putting in, and you put forth your hypothesis, you conduct a proper developmental pipeline in which you say that, okay, fine, this is something that is my hypothesis, this is my research hypothesis, and I will be going ahead with the proper clinical trial, and then the regulatory approvals take place. And after the clinical trial, you have a particular data, and then you develop a particular product, the research guidelines, and then you run it through regulatory approval committees, and then you take that data which is there, which is a result of your clinical study, and then you apply it to human diseases. All right, so this is how basic pipeline happens, and then we go to the a little bit more in detail of what I'm going to talk about with respect to ACTM and the clinical translational medicine in a clinical aspect. Next slide, please. Next slide, please. All right. So this is basically what essentially the clinical translational medicine means, that you should be having a translation from bench to bedside and from bedside to bench. What it means is that bench is a laboratory, bedside is in a clinic, and from bedside to bench is the other way around. Suppose you are having a particular research hypothesis to be proved, or you are having a particular research question. You understand from a literature and then you apply it to a particular place in your clinic. Better said. So in this, most importantly, we bring the plan what we do, and clinical development activities. Suppose there is a research team who has a clinical hypothesis and clinical development team which is providing the clinical input on the particular question and forth between the team and clinical. This is what is going to be a very concise way of how we are going ahead with in the field of translational medicine. Now, for example, the drug development. Suppose there is a particular disease to be tackled, and if you're looking at maybe TNIB inhibitors, so we're looking at leukemia. The new inhibitors which are going ahead and targeting a particular enzyme are in development. For that, you should be knowing which are the biomarkers in leukemia, in a particular type of leukemia. So if you're looking at CD20, for example, we have to make sure that CD20 is a biomarker which we are looking at, and we have to develop something which is against CD20. So what we need to understand in a very basic format is that we have to understand a disease, the stages of the disease and its progression, and the natural history of the disease, so as to know what we can do further as to which are the biomarkers we should be targeting at. Furthermore, we should be knowing what are the receptor profiles which are expressed in a particular disease. As in, what I talked about, CD20. CD20 is expressed in CLL, B cell type CLL. So we should be knowing, okay, this is something which is expressed, and rituximab is one of the treatment for CD20 positive BCLL. And this is the third point, also exemplifies the same thing which I was trying to say. It is to direct appropriate pharmacotherapy to a particular disease. Now, besides this drug development, even the vaccine development, the new biomarkers which are being developed, which are at the heart of translational medicine, is very pertinent in this particular slide, wherein we have to know what is the research which are already going on, and so that how we can complement the translational effectiveness of the research which is going on, and at the same time make sure that we are having better prospects within a particular disease and to fight a particular disease. All right, so this is going to be my last slide. It's a very brief presentation of what I intend to tell you through this webinar at the inaugural launch of ACTM. And I would like to conclude with a short note as to how we can expand the scope of what we are going to go ahead with the mission and the values of ACTM with the help of collaboration of everyone. And this is very important. It's very important to note that we are a team, and as Assistant Professor Dr. Pracheth said, that collaboration is the key to doing a good research. We intend to provide a platform at ACTM so as to provide a high output of clinical research and a good quality of clinical research. We go ahead with helping you publish it in the best possible way in high ranking journals, and this is what we intend to perform, put you on a platform or give access to you a platform which is very holistic, which is very broad, and it encompasses several disciplines and also embraces research in its truest sense. So I look forward to seeing you all in the ACTM, and hopefully we'll go ahead a long way in a long-term collaboration.